Why holding in a sneeze can kill you. A sneeze can leave your body at speeds reported as high as 100 miles an hour. That's not a breeze. That's a storm with an exit route. And every single time you clamp your mouth shut and pinch your nose to stop one, you point that storm back inside, at the softest, most fragile parts of your own body. Most people have done it. In a quiet meeting, in a library, on a first date. You feel the sneeze coming, and to be polite, you seal it in. It seems harmless. It isn't. Doctors even have a name for it, a stifled sneeze. And what it does is turn your body into a sealed pressure chamber with nowhere for the pressure to go. But to understand why sealing one in is dangerous, you first have to understand what a sneeze actually is, because it's not what you think. It isn't a cough. It isn't a hard breath out. A sneeze is a violent, fully coordinated explosion. When an irritant touches the lining of your nose, your brain fires off a reflex you have almost no control over. It pulls in a deep breath, builds pressure inside your chest, and then releases it all at once. Diaphragm, chest, and throat, contracting in sequence to blast air and mucus and whatever irritated you out of your body in a fraction of a second. A single sneeze can launch around 40,000 droplets into the air, and that spray can cross more than 20 feet of a room. It is one of the most forceful things your body does without ever asking your permission. And the entire mechanism is built around one assumption, that the air has somewhere to go. Out. Most people think holding a sneeze in is like holding in a burp. A little uncomfortable, a little awkward, but basically harmless. It isn't. A burp is a slow leak of gas. A stifled sneeze is you slamming a door on a detonation. When you pinch your nose and clamp your mouth at the exact instant your body fires, that wall of air doesn't politely disappear. The pump is still running. The pressure is still climbing, and it has to go somewhere. Think of your airways like a fire hose. Open the nozzle and the water goes exactly where it's meant to, forward, out. But leave the pump running and clamp the nozzle shut, and the water doesn't stop. The pressure backs up through the hose, hunting for the weakest seam, and it tears out there instead. Your body works the same way. Seal both exits at once, and that pressurized air reverses. It pushes up into your sinuses. It presses into your throat. It forces its way toward your ears through two narrow channels called the eustachian tubes, the little tunnels connecting the back of your nose to your middle ear. Air and mucus and bacteria, all driven backward into spaces that were never built to take that kind of force. And that's where the damage begins. That backward surge can push infected mucus straight into your middle ear and set off an infection. Push hard enough, and the pressure can rupture the eardrum itself, a sudden tear that can mean sudden hearing loss. All from a reflex you interrupted to be polite, and it doesn't stop at your ears. In the most extreme cases, holding in a sneeze can put you in a hospital bed, and this isn't a story someone invented. It's documented. In 2018, doctors in England published the case of a 34-year-old man, described as previously fit and healthy, who did exactly what you've probably done 100 times. He felt a forceful sneeze coming, pinched his nose, shut his mouth, and held it in. He felt a strange popping in his neck. A couple of hours later, the pain set in. When he reached the emergency room, the scans showed something disturbing. Streaks of air trapped in the soft tissue of his neck around his windpipe. In plain terms, he had blown a hole in his own throat. He couldn't swallow properly. His voice had changed. He spent around 2 weeks in the hospital, fed through a tube for the first 7 days before he recovered. His doctors left him with one instruction: never seal off both your nose and mouth to stop a sneeze again. You might think a torn throat is the worst of it. It isn't. That same trapped pressure has been linked to more of the body giving out. Strained necks, damage to the delicate structures of the voice box, injuries doctors would normally expect from a car crash, not a sneeze. And the specialists who published that 2018 case added a warning colder than anything else in their report. They cautioned that, in the rarest cases, that reversed pressure could reach the blood vessels in your brain and rupture a cerebral aneurysm. An aneurysm is a weak ballooning spot in an artery wall. Most people who have one don't even know it's there. And a rupture is a catastrophic, often fatal bleed. That isn't a sneeze death sitting in some file. It's a warning from the doctors themselves about where this pressure can, in the very worst case, end up. Which is exactly why they called it a dangerous maneuver that should be avoided. Now here's the part worth being honest about. The truly catastrophic outcomes are rare. Very rare. One head and neck surgeon asked about injuries like the man with the torn throat, said he sees maybe 1 or 2 a year. You are not going to die every time you hold a sneeze. Millions of people do it and walk away fine. But rare is not the same as never. Ear, nose, and throat doctors say they have personally treated patients with ruptured eardrums, pulled muscles, and worse. All from a reflex most of us were trained since childhood to suppress out of good manners. And that's the strange trait at the center of all this. The politeness you were taught, cover it, hold it, don't make a scene, is the exact instinct that on the wrong day with the wrong sneeze sends someone to the emergency room. Your body spent millions of years perfecting a way to violently eject a threat, and we override it on purpose to avoid a second of social awkwardness. So the risk is real, even if it's rare. Torn throats, shattered eardrums, damaged bone, and, in the worst case the doctors themselves warn about, a bleed in the brain, not urban legend, written down in medical journals, which brings us all the way back to where we started, you, mid-sneeze. Hand clamped over your mouth and nose, feeling that pressure swell behind your eyes, that split-second decision to keep it in. That pressure was never trying to hurt you. It was just air, moving at up to 100 miles an hour, looking for the one way out you decided not to give it. So the next time you feel it coming, do the one thing your body has been begging for all along. Let it go.